Hello and welcome. I am absolutely thrilled you're here with me today for this explainer. We are going to set out on a biological journey that is honestly fascinating, but also pretty urgent. We're taking a close look at something you probably do literally every single day without a second thought: drinking water. But as we unpack the source material today, you're going to see that maintaining the water inside of you is a serious, high-stakes balancing act. And failing to do so, well, it introduces this silent threat that affects absolutely everything from your mood to your muscles. Right off the bat, I want you to evaluate your current physical state. Are you thirsty right now? Just take a quick mental inventory. Does your mouth feel a little dry? Are you maybe eyeing a cup of coffee or a water bottle on your desk? We usually think of thirst as this helpful early warning signal from our body, right? Kind of like a fuel gauge letting us know that tank is getting a bit low. But as we're going to see, that harmless little sensation is actually the very first sign of our silent threat. I want to completely shatter any false sense of security you might have about your hydration habits. Our sources present a powerful medical consensus that you really need to hear. If you feel thirsty, you're already dehydrated. No way, right? But it's true. Thirst is not your body politely asking for a top-up in advance. It is a delayed alarm. Your body is already operating at a deficit. It means the silent threat is literally already inside the gates. Section 1, the foundation of life. Okay, let's dive into this. Water truly is the foundation of life. Depending on your age and other factors, water makes up roughly 60 to 78% of your adult body. Think about that for a second. You aren't just drinking water, you essentially are water. It is involved in every single cellular function you have. Water isn't just some beverage we consume, it's the primary physical environment where all of our biology actually happens. And this baseline is incredibly critical for your most vital organs. Your brain and your heart, the absolute command center and the primary engine of your body, are nearly 3/4 water. They sit right there at a highly sensitive 73%. If you deprive these organs of their primary building block, well, it's easy to see how the whole system might just begin to misfire. The body's reliance on water only builds from there. Take your lungs, for instance. A whopping 83% of your lungs consists of water. Every single breath you take, the very oxygen exchange keeping you alive right now, relies entirely on this profound level of moisture. Behind the scenes, all of this water is doing incredibly hard, totally unseen work. It regulates your body temperature so you don't overheat. It lubricates your joints so you can move around pain-free. Chemically speaking, your brain actually needs water just to create hormones and neurotransmitters. It even acts as a literal shock absorber for your brain, your spinal cord, and even for a developing fetus if you're pregnant. It is, without a doubt, the hardest working substance in your body. Section 2, mechanics of dehydration. So we constantly lose water throughout the day. But there are these common culprits that can drain our body's reserves dangerously fast. Excessive sweating on a hot day or during a workout is an obvious one. But illness, that is a massive accelerator. If you have a fever or if you're dealing with diarrhea and vomiting, your fluid levels can just plummet. Even everyday medications like diuretics, often called water pills, force your body to increase urination, actively pulling water right out of your system. Now, you might think it takes a massive loss of water to feel the effects, but look at this number. Just 1 to 2%. That is tiny. A 1 to 2% drop in your body's water is all it takes to trigger mild dehydration. That incredibly small margin is enough to start negatively impacting your cognitive performance. You don't have to be lost in a desert. You just have to miss a few glasses of water during a busy workday. Section 3, physical and mental toll. Dehydration basically launches a two-pronged assault on your system. Now, what's really interesting about this slide is how we see both sides happening at once. Physically, in column A, the mechanical breakdown begins. The loss of electrolytes causes painful muscle cramps and achy joints. Circulation slows down, leading to profound fatigue, and your urine turns a dark amber color. But then, in column B, at the exact same time, you are suffering a severe cognitive and emotional breakdown. Your brain slows its neural transmissions, creating brain fog and ruining your focus. Your body actually releases more cortisol, that's the stress hormone, leading to sudden anxiety spikes, mood swings, and irritability. You might feel terribly stressed and angry, simply because your body is crying out for water. And if you've ever had a dehydration headache, you know it is uniquely punishing. I want to share this surprising and, honestly, highly visceral biological fact from our sources. As your fluid levels drop, your brain tissue can actually contract. It literally pulls slightly away from the skull, triggering immense pain. It's a vivid mechanical explanation of exactly why those headaches hurt so very much. Section 4, spotting the warning signs. In adults, the warning signs can become bizarre and downright dangerous. Your body frantically tries to compensate for the lack of fluid, which can cause your heart rate to spike while your blood pressure plummets to dangerously low levels. Or sometimes it overcorrects and makes your blood pressure skyrocket. You might notice flushed, red skin, inexplicably swollen feet, or intense cravings for sugar. At the most dangerous end of the spectrum, adults can experience delirium, confusion, and slurred speech. But we also absolutely must issue a serious warning for our most vulnerable groups, infants and toddlers. Because they can't simply tell us they're thirsty, caregivers have to look for these terrifying visual cues. If a baby is crying but producing no tears, if the soft spot on their head appears sunken, if their eyes look sunken, or if they've gone 8 hours without a wet diaper, these are extreme red flags. This is your cue to call a healthcare provider immediately. To really understand how these symptoms progress, we can map out the 3 clinical levels of dehydration. Step 1 is mild. This is where you feel sluggish and thirsty, but you can fix it with oral fluids at home. Step 2 is moderate. This is where the body is struggling and requires IV hydration at an urgent care clinic or hospital. And Step 3 is severe. This is a life-threatening medical emergency where you need to call 911 or get to an ER right away. A little mild neglect can escalate to emergency hospitalization very quickly. And we have to be absolutely clear about the climax of our silent threat narrative. If severe dehydration is left untreated, the consequences are fatal. We are talking about severe electrolyte imbalances, heat stroke, the formation of painful kidney stones or total kidney failure, going into shock, falling into a coma, and yes, even death. Section 5. Treatment and prevention. Okay, take a deep breath. Let's bring some relief to the tension here. Now that we understand the stakes, the crucial point is this. The human body is incredibly resilient and responsive. If you're experiencing mild dehydration, simply drinking water can begin to improve your symptoms in just 5 to 10 minutes. Think about that. You literally have the power to reverse brain fog, relieve joint pain, and lower your stress levels in the time it takes to watch this explainer, just by drinking a glass of water. But what you drink matters immensely. In the hydrating column, plain water is your absolute best tool. If you're exercising for more than an hour, sports drinks are great for replacing electrolytes, and eating water-rich foods like watermelon is fantastic. But look at the dehydrating column. These are the wildly popular drinks that actually pull water right out of your body. Alcohol, caffeinated drinks, and sugary fruit juices. They can totally upset your stomach and actively promote the very dehydration you are trying to fight. For the active folks out there, whether you're playing a sport or doing yard work in the heat, our sources provide this exact clinical formula to prevent heat stroke and cramping. It takes all the guesswork out of it. 1 to 2 hours before you start, drink 16 to 20 ounces. During the activity, you want to be drinking 6 to 12 ounces every 10 to 15 minutes. And when you are all done, you need another 16 to 24 ounces to replace exactly what you've lost through sweat. So as we wrap up our explainer today, I want to leave you with one provocative final thought. I want you to ask yourself this very simple question right now. Have I had enough water today? Remember, your energy, your mood, your joints, and your brain are literally counting on it. I highly encourage you to get up, go grab a refreshing glass of water, and stay curious. Thanks so much for joining.